Captain Michael Reed was assigned to the medical team on a routine embassy evacuation in Kabul. When insurgents ambushed their convoy, Reed was captured while treating wounded soldiers. The terrorist leader Hakim Shah had a demand: perform life-saving heart surgery on their commander, or watch as all 300 embassy hostages are executed. "You're just a military doctor," they sneered, confiscating his weapons, but leaving his medical equipment. What they didn't know was that before medical school, Reed had served 6 years with Delta Force's elite counterterrorism unit. As he picked up his scalpel, Reed began formulating a plan that would turn his operating room into the most dangerous battlefield of his career. Kabul, Afghanistan, present day. The convoy should have reached the embassy 30 minutes ago. Captain Michael Reed checked his watch, then returned to stabilizing the femoral bleed on the young soldier sprawled across the Humvee's rear seats. "How bad is it, Doc?" Staff Sergeant Miller asked from the driver's seat, eyes constantly scanning the increasingly narrow streets. "He'll live if we reach the embassy in the next 20 minutes, Reed replied, his hands steady, despite the vehicle's jarring progress through Kabul's outskirts. "This route isn't on the evacuation plan." "Where are we going, Miller?" The sergeant's hesitation was answer enough. They were lost, separated from the main convoy, after the IED had disabled their communications. Reed had been assigned to the embassy evacuation as senior medical officer, a routine assignment that was rapidly deteriorating into something far more dangerous. His primary role was supervising the evacuation of diplomatic personnel with medical conditions, not treating combat casualties in a compromised vehicle. "Contact left," the gunner shouted suddenly, swiveling the mounted weapon. The world exploded into chaos. Reed instinctively threw himself over his patient as bullets shattered the armored glass. Miller swerved hard, attempting to break through the ambush, but the narrow street offered no escape route. "Doc, we need to move," Miller shouted, abandoning the disabled vehicle and returning fire from behind the engine block. Reed assessed the situation with the cold calculation that had once been his stock in trade. His patient couldn't be moved without stabilization. The rest of the squad was pinned down with minimal cover. "Give me covering fire," Reed called, rapidly packing the wounded soldier's injury and preparing to move him. Before medical school, before the officer commission and the respectable military medical career, Captain Michael Reed had been Sergeant First Class Reed, Delta Force operator, with 6 years of counter-terrorism operations across 3 continents. The skills remained, buried beneath the physician's training, but never forgotten. As Miller and the gunner laid down suppressive fire, Reed moved with the practiced efficiency of someone accustomed to combat zones. He dragged his patient behind a crumbling wall, administering a blood expander and securing a tourniquet with practiced hands. "Miller, East Alley, 30 meters. Get there and you can reach the secondary extraction point," Reed directed, his voice calm despite the intensifying gunfire. "What about you and Ramirez?" Miller called back, gesturing toward the wounded soldier. "I'll stabilize him and follow. Go." As Miller and the gunner fought their way toward the alley, Reed worked frantically to get Ramirez stable enough for transport. He was so focused on his patient that he didn't register the approaching insurgents until it was too late. "American doctor," a voice said in accented English. "Stop or we kill you." Reed looked up to find himself surrounded by 6 armed men, their weapons trained on him and Ramirez. His hand instinctively moved toward the sidearm concealed beneath his medical jacket. "Your friends are dead or gone," the voice continued. "The wounded man will die without proper care, and you, a doctor, is valuable to us." Reed's mind raced through his options. Combat was out of the question, too many hostiles, and Ramirez would be caught in the crossfire. Escape was impossible while carrying his patient. That left one option: cooperation, at least temporarily. "I need to stabilize him," Reed said, gesturing to Ramirez, or he dies in minutes. The apparent leader of the insurgents studied him for a moment, then nodded. Do it quickly, then you come with us. As Reed worked to save Ramirez's life, he took careful note of his captors. Their weapons, organization, and discipline suggested this wasn't a random Taliban unit. Their tactics had been too coordinated, their English too precise. When he had done all he could for Ramirez, Reed was blindfolded and pushed into a waiting vehicle. His medical bag was tossed in beside him, a small mercy that might prove useful later. "Where are you taking me?" he asked as the vehicle lurched forward. "To someone who needs a doctor," came the cryptic reply. "A very important doctor with American training." Reed fell silent, focusing instead on mapping their journey through sounds and vehicle movements. His Delta Force training had included extensive counter-interrogation and hostage survival protocols. Rule 1. Gather intelligence passively at every opportunity. After approximately 40 minutes of travel, the vehicle stopped. Reed was pulled out and marched through what felt like a series of corridors before the blindfold was removed. He found himself in what appeared to be a makeshift medical facility, a clean room, with basic but functional equipment. Standing before him was a tall bearded man with a cold, assessing gaze. "I am Hakim Shah," the man said without preamble. "You are now the personal physician to Commander Kazim, leader of the Islamic Liberation Front." Reed had heard intelligence briefings about the ILF, a newly formed terrorist organization with suspected ties to state actors, more sophisticated and better equipped than typical insurgent groups. "I'm a trauma surgeon, not a personal physician," Reed replied carefully. Shah's expression hardened. "Commander Kazim requires immediate cardiac surgery. You will perform this surgery, or 300 hostages at the American embassy will be executed, one every hour." Reed's blood ran cold. "The embassy has been taken, while your convoy was conveniently delayed," Shah confirmed with a thin smile. "Your choice is simple, doctor. Save one life, or condemn hundreds." As Shah turned to leave, he paused. "You should know, Captain Reed, that we have removed anything from your medical kit that could be used as a weapon. You are, after all, just a doctor." The door closed, leaving Reed alone with his thoughts. Just a doctor, if only they knew. Before becoming a healer, Michael Reed had been one of the most effective operators in Delta Force's history, with specialized training in improvised weapons and escape tactics. Now those skills would be put to their ultimate test. The patient's condition was genuinely critical. That much was immediately clear to Reed as he conducted his examination. Commander Kazim, a heavy-set man in his 50s, with a face lined by years of hardship and violence, had all the hallmarks of severe coronary artery disease, complicated by what appeared to be congenital heart defect. Previous surgery, Reed noted, identifying the telltale scar on Kazim's chest. Where was it performed? Germany. 15 years ago, Kazim replied between labored breaths. They said it would last 20 years. Reed continued his assessment, his medical training automatically taking precedence. Despite the circumstances, you're experiencing acute heart failure. The previous repair is deteriorating. Without intervention, you'll die within 48 hours. Hakim Shah, who had been watching the examination with hawkish intensity, stepped forward. "Can you fix it?" Reed chose his words carefully. "It requires open-heart surgery with specialized equipment. I'd need a full surgical suite, blood matching his type, specific medications." "Write it down," Shah interrupted, pushing a notepad toward him. "Everything you need. We have resources." As Reed compiled the list of necessary equipment and medications, his mind was working on multiple tracks. Track 1, the legitimate medical needs to keep Kazim alive. Track 2, items that could serve dual purposes, medical uses, and potential weapons or escape tools. Track 3, understanding the facility layout and security protocols. "I'll need an assistant," Reed added, looking up from his list, "preferably someone with medical training." Shah considered this request with obvious suspicion. "Why? Cardiac surgery requires at minimum 2 pairs of hands, Reed explained. One to perform the primary procedure, another to monitor vitals, administer medications, and assist with tools. Without an assistant, the commander's chances drop significantly. After a moment's consideration, Shah nodded. We have a nurse among the hostages. She will assist you. This was Reed's first confirmation that the hostages were being held at or near the same location. Valuable intelligence, carefully filed away. When will you begin? Shah demanded. Reed assessed Kazim's condition again. His heart is failing, but he's currently stable. Rushing into surgery without proper preparation would kill him. I need 12 hours to set up, review his medical history, and prepare the equipment. Shah and Kazim exchanged a look, then Shah nodded curtly. 12 hours. If he dies, doctor, the hostages begin dying immediately. As they escorted Reed to what would serve as his surgical preparation room, he took careful note of the building's layout. The structure appeared to be a former medical clinic, repurposed as a terrorist stronghold. 3 armed guards at each major junction, security cameras with visible blind spots, approximately 20 armed personnel visible during his brief walk. In the preparation room, a former storage area, hastily converted for medical use, Reed found his requested supplies already being assembled. The terrorists' resource network was impressive and concerning. A young woman was brought in, her expression a mixture of fear and defiance. This is Nurse Farida, Shah introduced brusquely. She will assist you. After Shah left them alone, though certainly under surveillance, Reed approached the nurse carefully. I'm Captain Michael Reed, U.S. Army surgeon. He introduced himself quietly. Are you from the embassy? She nodded slightly. Farida Ahmadi. I was working at the embassy clinic when they attacked. There are over 300 hostages, including diplomatic personnel and local staff. Any other military personnel? Reed asked, organizing surgical instruments while they talked. A small marine security detachment. They're being held separately. Her voice dropped even lower. They're planning to execute them first if their demands aren't met. Reed processed this information while maintaining a professional facade of medical preparation. Say, what do you know about the layout of this place? It's the old Kabul Medical Center. 3 floors, basement level with generators. The hostages are being held in the former patient wards on the 2nd floor. Farida hesitated. There's something else. I overheard guards talking. They have explosives throughout the building. If military forces attempt a rescue, Reed nodded grimly. The situation was deteriorating by the minute. The conventional rescue attempt would likely result in massive casualties. Then we need to focus on keeping the commander alive while looking for an opportunity, Reed murmured, ensuring his back was to any surveillance cameras. I have certain skills beyond medicine that might help us. Farida studied him with new understanding. You're not just a doctor. Not originally. No, Reed confirmed. Now let's review the commander's medical history, while I explain exactly how we're going to handle this surgery. Over the next several hours, Reed and Farida prepared for the complex cardiac procedure. To any observer, they appeared to be 2 medical professionals methodically preparing for a life-saving operation. What the surveillance couldn't detect was the secondary conversation happening in medical terminology and subtle gestures. Reed outlining a daring plan that would use the surgery itself as cover for their only chance to save the hostages. The hardest part will be timing, Reed explained as they sterilized instruments. Too soon, and the commander dies on the table, triggering immediate hostage executions. Too late, and we lose our only leverage. Farida's hands trembled slightly, but her voice remained steady. I understand. Though what exactly do you need me to do? Reed detailed his plan, audacious, dangerous, and their only hope. By the time their preparation period ended, both were clear on the high-stakes gambit they were about to attempt. When Shah returned to escort them to the main operating theater, Reed had transformed fully into the consummate medical professional, his demeanor confident, focused entirely on the procedure ahead. Remember, doctor, Shah said as they entered the makeshift operating room where Kazim waited. His life for 300 others. Choose wisely. Reed met his gaze steadily. I always do. The operating room had been established in what was once the clinic's primary treatment area. Despite the terrorists' hasty modifications, Reed had to admit they'd done a reasonable job creating a functional surgical suite. The equipment was modern, the medications genuine, and the monitoring systems adequate. Commander Kazim lay sedated on the operating table, intubated and prepared for the procedure. Nurse Farida stood opposite Reed, her hands steady despite the pressure. Beginning primary incision, Reed announced for the benefit of Hakim Shah, who observed from behind a glass partition, communication device in hand, the implied threat clear. Any problem with the commander would trigger immediate consequences for the hostages. Reed worked with the practiced precision that had made him one of the Army's top trauma surgeons. His hands moved with economy and confidence as he opened Kazim's chest cavity and established the bypass that would allow him to work on the heart. Bypass established, heart function temporarily suspended, Reed narrated, knowing that these technical details would mean little to Shah, but would maintain the appearance of transparency. As Reed began the delicate work of repairing Kazim's failing heart valve, he implemented the first phase of his plan. Using medical terminology that would sound routine to observers, he gave Farida coded instructions. Need increased flow rate on bypass, 3.5 liters, he said, their signal to prepare phase 1. Farida adjusted the bypass machine, simultaneously palming a small vial from the medication tray. With her back to the observers, she prepared a syringe with a precise mixture of compounds that Reed had specified during their preparation, medications that in combination would create a specific physiological response when introduced to Kazim's system at the right moment. Exposure inadequate, adjust retraction and provide suction, Reed directed, creating a legitimate reason for Farida to move specific instruments into position. 4 hours into the procedure, with Kazim stable on bypass and the valve repair nearly complete, Reed initiated the next phase. We're encountering unexpected calcification, he announced, introducing a planned complication that would justify extending the procedure. Need to debride carefully before proceeding. This manufactured delay served a critical purpose, aligning their timeline with the guard rotation schedule they had observed. Reed had noted that the most significant shift change occurred at approximately 2100 hours, when the night team took over. As he methodically worked, Reed was hyper-aware of everything in the room, the positioning of the guards, the functioning of the surveillance cameras, the timing of check-ins between Shah and his lieutenants. Every detail fed into his evolving strategy. Beginning to close the aorta, Reed announced at the 7-hour mark, making eye contact with Farida. This was the critical moment. Once Kazim was taken off bypass, they would have a narrow window for action. Preparing to transition from bypass, Farida confirmed, subtly adjusting the syringe she had prepared hours earlier. Reed completed the final sutures on Kazim's heart with textbook precision. To any medical observer, he was performing flawlessly, giving his patient the best possible chance at survival. Only Farida understood that he was also calibrating the commander's recovery timeline to serve their escape plan. Bypass terminating, resuming normal circulation, Reed announced, beginning the process of allowing Kazim's heart to resume function. As the bypass machine was gradually disconnected, Reed nodded imperceptibly to Farida, who administered the prepared medication into Kazim's IV line. The compound would ensure the commander remained stable, but would induce a specific pattern of blood pressure fluctuations that would demand constant monitoring over the next few hours, requiring Reed's continued presence and access. Heart function resuming normally, Reed reported as Kazim's repaired heart began beating on its own. However, we're seeing some pressure irregularities that need close observation during recovery. Shah stepped closer to the glass, his expression a mixture of relief and suspicion. The commander will survive. The surgery was successful, Reed confirmed, beginning the process of closing Kazim's chest. But the next 6 hours are critical. He needs constant medical supervision to ensure stable recovery. This was the cornerstone of Reed's strategy, creating a medical justification for his continued access to the commander, which would place him in proximity to Shah and the terrorist leadership during the vulnerable night hours. As they completed the final stages of the procedure, Reed and Farida exchanged a look of shared understanding. The surgery had gone according to plan. Now came the truly dangerous part, transforming from healers to liberators. Patient ready for transfer to recovery, Reed announced, setting in motion the next phase of his daring gambit. The recovery room had been established in what was once the clinic director's office, converted now to serve as both medical recovery space and de facto command center. Maps of Kabul adorned the walls, with the American embassy prominently marked. Communications equipment hummed in the corner, monitored by a terrorist operative who maintained contact with the hostage holders. Commander Kazim lay unconscious but stable, his vital signs displayed on the monitoring equipment Reed had insisted upon. Hakim Shah and 2 lieutenants conversed in hushed tones near the doorway, occasionally glancing toward their leader with evident concern. His blood pressure is fluctuating, Reed reported, adjusting one of the IV medications. It's expected after such a procedure, but requires careful management. Shah approached, studying the monitors with suspicion, though clearly unable to interpret the medical data. How long until he wakes? We're keeping him sedated for now, Reed explained. The next 6 hours are critical. Premature consciousness could place strain on the repair. Shah seemed dissatisfied with this answer, but unable to dispute the medical necessity. One of us will remain here at all times, he stated firmly. Of course, Reed agreed smoothly. Nurse Farida will need to retrieve additional medications from the surgical suite. The commander's blood pressure requires specialized stabilization. After a moment's consideration, Shah nodded to one of his men. Escort her. Return immediately. As Farida left with her guard escort, Reed continued his methodical patient assessment, mentally updating his situational analysis. The guard rotation had occurred as observed previously, with a noticeable reduction in personnel during the night shift. From snippets of conversation, he had confirmed that the hostages were indeed being held on the 2nd floor, with the Marine Security Detachment isolated in a separate room, under heavier guard. The operation was entering its most dangerous phase. Everything that followed would require precise timing, split-second decisions, and the kind of tactical judgment Reed had honed during his years in Delta Force. When Farida returned 20 minutes later, she carried a tray of medications and supplies. Only Reed noticed her subtle hand signal, confirmation that she had completed her assigned task of placing prepared packages of improvised sedatives in predetermined locations throughout their planned route. His pressure is still unstable, Reed announced, manipulating the monitoring equipment to display concerning readings. I need to adjust his medication protocol. As he worked, Reed positioned himself to block the camera's view of his hands. With practiced sleight of hand, he palmed several items from the medical tray, a scalpel concealed in his sleeve, syringes with prepared sedatives in his pocket, and a length of surgical tubing that could serve multiple tactical purposes. Shah, crackled a voice from the communications device. American forces are mobilizing at Bagram. Satellite shows increased activity. Shah moved to the communications station, engaging in rapid discussion with his operatives. This momentary distraction allowed Reed to exchange critical information with Farida. Southeast stairwell clear, he murmured, adjusting Kazim's IV line. Yes, 2 guards, rotating every 30 minutes. She confirmed under her breath. Explosives on all main exits. Detonator with Shah. Reed processed this information as he continued his medical work. The presence of explosives complicated matters significantly, but didn't change the fundamental plan. When I create the diversion, get to the 2nd floor and prepare the hostages, Reed instructed quietly. priority is locating the Marines. We'll need their assistance. Farida gave an almost imperceptible nod, her hands steady as she recorded vital signs on the medical chart, a performance for their observers. As midnight approached, Reed implemented the next phase of his plan. He intentionally adjusted Kazim's medication, causing the commander's blood pressure to spike dramatically, a controlled medical emergency that demanded immediate response. Pressures climbing dangerously, Reed announced with practiced urgency. I need to adjust his medication immediately, or the surgical repair could fail. The sudden medical crisis created exactly the distraction Reed needed. As Shah and his lieutenants focused on their leader's fluctuating vital signs, Reed positioned himself near the room's primary guard, while preparing a syringe with a fast-acting sedative. Hand me that vial, Reed directed Farida, pointing to the medication tray. As she complied, he deliberately knocked over a stack of monitoring equipment, creating a loud crash. The guard instinctively turned toward the noise, the moment Reed had been waiting for. With the precision of his special operations training, Reed struck, driving the concealed syringe into the guard's neck and administering the sedative before the man could react. As the guard collapsed, Reed moved with explosive speed, retrieving the man's sidearm and engaging the second guard before alarm could be raised. A controlled strike to the throat silenced any warning cry, followed by a precision blow that rendered the man unconscious. Shah reached for his weapon, but froze as Reed leveled the captured pistol at him. Commander Kazim is stable, but completely dependent on those medications, Reed stated calmly, his demeanor transformed from physician to operator in seconds. If you want him to survive, you'll do exactly as I say. Shah's eyes darted between his unconscious leader and the suddenly dangerous doctor. You're no ordinary surgeon. No, Reed confirmed, securing Shah with surgical tubing, while Farida collected the fallen guard's weapons. Before medicine, I had a different specialty. Now, where is the detonator for the explosives? With Shah secured and the immediate threat neutralized, Reed and Farida moved with practiced efficiency. Years of Delta Force operations flooded back to Reed, the methodical room-clearing procedures, tactical movement through hostile environments, and priority-based decision-making that had once been second nature. The Marines are being held in the former radiology department, Farida reported, having extracted this information from Shah. 15 terrorists on the second floor guarding the main hostage group. Reed quickly formulated a plan, balancing the need for speed against the risk to hostages. We move to free the Marines first. We'll need their help to secure the building. Shah comes with us as leverage, forcing the terrorist leader ahead of them. Reed and Farida navigated the darkened corridors of the former clinic. The prepared sedative packages Farida had placed earlier proved invaluable, allowing them to neutralize 2 guard positions without raising alarms. When they reached the radiology department, Reed implemented a classic Delta Force entry technique, creating a distraction at one entrance while breaching through a secondary access point. The 8 Marines held inside responded with immediate military discipline, quickly subduing their surprised guards and arming themselves. Captain Michael Reed, U.S. Army. Reed introduced himself to the Marine sergeant, former Delta, currently Medical Corps. The sergeant sized him up quickly, professional recognition passing between them. Sergeant Lopez, Embassy Security Detail. What's the situation? Reed provided a concise tactical briefing, the number and distribution of hostiles, the location of the remaining hostages, and the presence of explosives throughout the building. With Shah as their reluctant guide, they formulated a coordinated plan to secure the facility. The explosives are on a remote trigger, Shah revealed under duress. The detonator is with my second-in-command, Ahmed. This complicated matters. Reed divided their forces. 4 Marines would accompany him to locate and neutralize Ahmed, while the others, led by Sergeant Lopez with Farida as guide, would begin evacuating hostages through the route Reed had already secured. What followed was a methodical clearing operation that combined Reed's special operations expertise with the Marines' combat training. Moving room by room, They secured the second floor, neutralizing terrorist resistance with surgical precision. When they encountered Ahmed in the main communications center, the terrorist attempted to trigger the detonator. Reed's reaction was instantaneous, a precision shot that incapacitated Ahmed's arm before he could activate the device. With the detonator secured and the immediate threat neutralized, Reed coordinated with Sergeant Lopez to complete the hostage evacuation. Over the next 2 hours, they methodically cleared the building, disarming explosives with guidance from the captured terrorists and establishing a secure perimeter. By dawn, U.S. military forces had responded to their emergency transmission, arriving to secure the area and formalize the hostage rescue. All 300 embassy personnel had been freed with minimal casualties, a near miraculous outcome, given the circumstances. As medical evacuation helicopters arrived, Reed found himself returning to his physician role, directing triage and treatment priorities for the freed hostages. The transition between operator and doctor now seemed seamless, two essential parts of his identity working in harmony. Commander Kazim remained stable, his survival now a valuable intelligence asset rather than a terrorist demand. Shah and the surviving members of his organization were taken into military custody, their planned spectacular hostage execution transformed into one of the most successful rescue operations in recent military history. As Reed finally allowed himself to be treated for the minor injuries he'd sustained during the operation, Farida approached him. "They said you were just a doctor," she remarked, with newfound respect. "I don't think they'll make that mistake again." Reed smiled slightly, the adrenaline finally beginning to subside. "Most people see what they expect to see. Sometimes that's an advantage." A senior military officer approached, his expression indicating he'd been briefed on Reed's extraordinary actions. "Captain Reed, I've been instructed to debrief you immediately. Washington is very interested in how a medical officer managed to single-handedly initiate a hostage rescue of this magnitude." Reed nodded, understanding the questions that would follow. His carefully maintained separation between his medical career and his classified operational history had been irrevocably breached by the night's events. "Just doing my job, sir," he replied simply. "All of my jobs." As he boarded the evacuation helicopter, Reed reflected on the strange circularity of his career. He had left Delta Force to save lives as a physician, only to find that sometimes, saving lives required the very skills he had tried to leave behind. The terrorists had dismissed him as just a doctor, never imagining that the man holding the scalpel had once been among America's most effective operators. Their fatal miscalculation had saved 300 lives and demonstrated that sometimes the most dangerous person in the room is the one everyone underestimates. If this incredible story of a doctor's secret past and daring hostage rescue captured your imagination, hit that subscribe button to join our community of military story enthusiasts. Have you ever discovered that someone you know had unexpected skills or training that emerged in a crisis? Share your experiences in the comments below. We read every single one and would love to hear your stories. Do you think many veterans bring their military expertise into civilian careers? Let us know your thoughts, and don't forget to turn on notifications by clicking the bell icon so you never miss our daily uploads of extraordinary true military stories.